Namaste, everyone. A very warm welcome to the session. The title of today's talk is Listen to Your Pimple, Keep It Simple, a holistic view on the treatment of acne. Our guest speaker today is Dr. Mankul Goyal, who is MBBS and MD from AIIMS Delhi with a specialization in the field of dermatology. After his MD, he was drawn towards alternative systems of medicine like Ayurveda, Homeopathy, Acupuncture, various forms of energy healing, and evolved versions of allopathy like functional medicine. Having explored these systems, he is following an integrative model of medicine at his clinic, Sampurnam, in South Delhi, where various specialities are available under one roof with holism and spirituality at its core. Welcome, Dr. Mankul. It's so nice to have you with us today. Thank you so much for joining. We look forward to your interesting session. Over to you.
Thank you, Arinima, for generous introduction, and always a pleasure to speak on Yes, and so many wonderful people to hold space for you, and so many wonderful people to listen to you. And I think in every session, the speaker equally grows as the listener grows. So happy to be part of this satsang, which is centered around acne. And thank you to all the people who are listening, and thank you to all the people who will listen to this. And I'll start my presentation. So let me just share the presentation. I hope it is visible to everyone.
Yes.
So I think the interesting name of the presentation evolved from, somehow it just came to me because these are the two things that we try to do in practice for acne. Any patient who comes with pimples to us, so our intention is to usually their question is, डॉक्टर इसको किसी तरह खत्म करो, अभी के अभी इसको खत्म कर दो किसी तरह. But where we draw the attention of the patient is that listen to your disease, honor the disease, whatever is the expression in the body or on the skin, honor it and listen to it. What is it telling you? So that becomes it immediately shifts the attention of the patient towards something which is very important, that is to listening to your disease. And in this context of pimples, listening to the pimple. And keep it simple, meaning evolved from the fact that at this point of time, there are so many different treatments available. It's almost like you enter a dermatologist clinic and, that's what I've heard, that there are people ready to pounce upon you, कि ये वाला procedure करा लो, ये वाला procedure करा लो, ये chemical peel करा लो. So many different things in order to take care of pimples, which may not be necessary. The pimple treatment can be very, very simple. So that is the whole ideology and the core of the message that will come across from this session. And the first half of the section is about listening to the pimple. So before we go there, let's understand what does pimple look like, and usually we see different forms of pimples on the skin. There are whiteheads and blackheads, which look like almost skin colored. Whiteheads look like almost skin colored little bumps, very tiny little bumps on the skin. And blackheads, which are the same as whiteheads, but they have been opened up. So they have that black. We'll talk about what blackhead represents. So there are tiny little blackish things also which are visible, bumps which are blackheads, and then there are red pimples. There are big nodules, kind of cystic acne, and then there are pus-filled acne. So usually we see these five things to break it down when we are seeing in a patient of acne, these five different things on their face. And acne may not be just on the face, it may be on the back, chest, arms also for a patient. So listening to the pimple. Now let's come to why does a pimple happen? What is happening? And let's try and look at it from the perspective of looking at it because you're not eating right. But let's look at what is happening on the skin which relates to what's happening inside. So if we see, this is a hair follicle, and around it, so this is your skin, and in the skin, this is the oil gland, and this is the hair. So on the face also, there are tiny little hair all across the face, which may not be visible to us because they're very micro hair, and some obviously coarse hair. But in all these hair, there are every hair is coming out through a pore. And right next to this or underneath this hair and pore is an oil gland right next to it. And in the reference of acne, we refer to the oil gland as the brain of the skin. It is the oil gland through which all the different things are manifesting in a person. So, in the sense that if there is something in their diet which is causing acne, it is causing inflammation in the oil gland, and then the oil gland is making more secretions or such secretions which get and block the pore, and then an acne can form. So it's the quantity and the quality of the oil secretion from the oil gland which has a huge role to play. In some people, it is the quantity of the oil secretion, which may be so much that it kind of repeatedly blocks the pores and makes whiteheads and blackheads. So those blackheads are basically oil secretions mixed with cells of skin with dirt and bacteria, forming a clogged blackish pore. When it is covered with the skin, it's a whitehead. When it's not covered with the skin, then it's a blackhead. So that is what we refer to as a, brain of the skin, which is the oil gland. And whether it is dust from outside, that also irritates that oil gland, whether it is pollution, whether it is food, whether it is hormones. Some people have excessive hormones, so they make the skin more oily. So some things increase the quantity of oil secretion, and some things affect the quality of oil secretion, and hence they cause acne. So this is at the very root and a simple understanding of why do people uh, get acne at a local level. What is going on at the skin level when people get acne? And now with this understanding, we can go one level deeper and look at what is happening in what are the other factors which are affecting acne and how they are affecting it. So here we are going to look at gut and acne. So gut again is it's it's I would say involved in about 70% of the patients who have acne. Gut issue is one of the um, either the most important or the second most important factor. जैसे आयुर्वेद में कहते हैं every disease starts from पेट से शुरू होती है. So we see that that is quite true for acne as well. And we do see that how does gut play a role in acne? It is very different ways. And one of the ways we look at it is the gut microbiome, that what kind of microbes are present in the gut. We've done a talk in Yes on microbiome. So what we see is that our own cells are 1% of us, 99% of the DNA in us is from microbes. And a large percentage of that is present in the gut and on the skin. And the quality of those microbes depends on the food that we eat, the emotions that we have. And if those microbes are unhealthy, then in the gut, then they also impact the skin as well. And on the skin also, we see the growth of unhealthy bacteria, which then colonize, which form colonies inside these pores and create reddish acne. So gut is a very important player, and there also we see very often some patients will come and tell us that हमें constipation हुआ, जब जब हमें constipation होता है हमें pimples निकल आते हैं, हमारी बॉडी में हीट बढ़ जाती है तो हमें पिंपल हो जाते हैं. Some people will say that the moment they उनका पेट खराब है, लूज मोशन हो रहा है, तब उनको पिंपल्स हो जाते हैं. We see some patients that they have a lot of gas production, and we see that they get pimples. One of the very beautiful evidence that we have for pimples being affected by gut is there's a medicine called rifaximin. It's an antibiotic, and the beauty of this antibiotic is that it remains only in the gut. It doesn't reach your skin or goes into other organs of the body. And when we give it to the patient for their gut issues, many of times they come and tell us that their skin has improved. So here is a medicine which is only and only limited to your gut, which doesn't even reach your skin, and we know very clearly that usse pimples better हो जाते हैं, and we actually do it as a test to validate it to the patient कि देखो ऐसी दवाई खाई है जो आपकी स्किन में गई नहीं है फिर भी आप बेटर हो गए हो. तो अब तो आपको मानना पड़ेगा कि पेट से तो जुड़ा हुआ है ये acne आपका. So that is um, one way to understand and look at this, that how gut and acne are related. Then another very common pattern we observe is PCOD and acne, which is one may say a part of adult acne. So, or not even adult, even in teenagers. But women come to us with hormonal disturbances, and usually in those women, the acne is more in the lower face. So, if some woman has acne, which is jawline acne in this area, then very often it is related to hormonal acne or it's coming before their periods. So it can very often be a hormonal PCOD related acne. So that's another thing we need to be very vigilant of. One is gut, and second is hormones. And amongst the hormones, one hormone is related to PCOD. And usually there is another syndrome which is associated with it, which we very commonly see is Saha syndrome. Saha syndrome refers to S for seborrhea, which refers to very oily skin. So some women will have very oily skin. A refers to acne. H refers to hirsutism. So they'll have a lot of facial hair. And the last A refers to alopecia. So we see women with this syndrome where they have facial hair, they have acne, they have a very oily skin, and then they have scalp thinning of hair. So this syndrome, behind this syndrome lies a lot of excess male hormone in women. So a lot of women at this point of time, whether it is because of a lot of stress or whether it is because of PCOD or because of genetics, various other factors, they are producing excess of male hormones. It's important to understand that both men and women have male hormones and female hormones. We both have the feminine side to us and a masculine side to us. So it's nothing unusual. We all women and all men have both kinds of hormones. It's just the balance. Sometimes it gets tipped in women towards excess male hormones, and which is usually again which can be multifactorial, but I shared some common factors: stress, sleep, again, weight gain, PCOD. So these can be common factors behind this. But eventually, for whatever reason it's happening, it presents like this. So as a doctor, we need to be vigilant about Saha syndrome as also being a part of acne. Then there is sleep and acne. So sleep is a major factor when it comes to acne. Um, Again, here we can take a reference from how Ayurveda looks at acne. So, for Ayurveda or in alternative medicine, the general wisdom is that the skin disease are very much linked to liver, and liver inflammation leads to blood inflammation, and then blood inflammation comes out on the skin. So we talked about gut and acne. If the gut is inflamed, it affects the liver, क्योंकि जो हम खाना खाते हैं वो gut से absorb होके liver में जाता है, and then it comes into the blood and on the skin. So if there is liver inflammation, then very often there is acne. And if we now take a quote from science also and from traditional Chinese medicine, in traditional Chinese medicine also, it is seen as 10 to 2 is the main time for sleep, 10 to 2 or 11 to 3. And if we see, science tells us that 9 p.m. melatonin secretion begins, which is the sleep hormone. So usually if one is following the circadian rhythm, which means one is out in sun in the day and one is not exposed to LEDs in the night and there is dark, then melatonin starts at 9 p.m. and it starts to peak. And as they've written, 2 a.m. is the deepest sleep. So during this period, we um, not just have the best quality of sleep, but according to traditional Chinese medicine, this is the best time for liver detoxification. And for the liver to be detoxified, two conditions have to be met. One is at this time we are sleeping, and second, we have already digested our food. If the liver is digesting the food at that time, then it cannot be detoxifying itself. So digesting process is something for the liver to digest the food, at least we need to give it 3 hours, ideally 4 hours. So eating by 6 or 7 again becomes very important, and sleeping by 10 or 11 becomes very important. So this whole process, if we are engaging in properly, then the acne doesn't happen. But usually what we are seeing, especially in metropolitan life, is that people are used to eating at 8 or 9 or even later, and then sleeping by 12, 1, 2, 3. I mean, there's no limit these days. We made a joke out of it that people are experiencing Brahma Muhurat in a different way these days. They are staying awake, the teenagers at 4 a.m. in order to experience the Brahma Muhurat. So that's what's happening right now. So sleep has a very important role directly also, because if we see melatonin from a scientific perspective also is one of the most important healers or rejuvenating hormone. And not just melatonin, in fact, all the other hormones like growth hormones, they're all made during that time. So they have the best healing and rejuvenating properties. So they directly also heal the acne better. It helps detoxify the liver also better, and also prevents PCOD and many hormonal disorders. So sleep is a very integral part of acne. Then food. So food also is a very important player, because we just looked at it. It affects the gut microbiome, it affects the liver. But we very often see that there are certain foods which are affecting the acne the most. For example, milk is a very common player in acne, because again, this is nothing. Milk has its own positives and its benefits, but from an acne perspective, a person whose oil gland is already exposed to a lot of hormones. Milk in a way is a pregnant female's hormones. So it has furthermore hormones which can promote acne. So it's one thing that we have observed. Obviously, the quality of milk matters, the context matters. We usually, if it's a teenager or an early teenager still growing, then we sometimes prioritize growth and we don't entirely say to stop milk. But in some cases, we tell them to minimize milk. But let's say somebody is already beyond the growing age and the context is different, then it is better to consider stopping milk. Then the carbs. Carbs are also a very important player, because they um, carbs trigger a sugar insulin metabolism imbalance. A lot of carbs. If one is eating roti, rice, maida, breads multiple times in a day, then that also has an impact on the sugar insulin. metabolism, and we'll look at it in a few slides from here, that how high levels of insulin can also cause acne. So grains are a very important player if you're consuming carbs again and again through the day. Then sweets and certain foods like chocolate and coffee, they can also even directly produce heat. Sometimes it's nuts. So some foods are very heaty. So they can also directly increase acne. Again, it is not true for everyone. It is very individualistic. So those people can observe these things that every time they consume chocolates, they start getting acne. So it is a bit of an elimination and starting that again and seeing what happens. Then processed food. Now, processed food adds to uh, both inflammation in the body and weight gain and phlegm and toxins. Now, these processed foods have a lot of hormone disrupting chemicals. We refer to them as EDCs, endocrine disrupting chemicals. तो ये सब चीजें जब होती हैं तो उनसे भी होता है. So they also bit by bit they accumulate and they also then cause acne. Then it is also about the timing of the food. It is not just about what we eat. Um, Also, here I must mention that sometimes we also see food intolerances being involved. I always give an example of a young girl who was 20 and she had been having acne for 5 years. And she had absolutely no symptom in her stomach. She was absolutely fine. Her gut was absolutely okay. And what happened is that she had been to multiple skin specialists and no treatment had ever helped her. I also tried to help her, but in 2 3 months of treatment she was not getting any good positive outcome. So we usually like to do a food test when such situations arise, and many a times people even don't have any digestive system symptom, so we call it a silent gut. So then also sometimes people can have these issues. So we did a food test and she was gluten sensitive. And she left gluten and within a month her all her acne disappeared. And she now 3 4 years hence still stays acne free. So we have to realize that very often food can be involved as allergies or intolerances also in people, and avoiding that can make a huge difference. On the other hand, there are a lot of beautiful foods which can be helpful in acne. For example, a carrot beetroot juice, a vegetable juice, is excellent for acne. Good fats, vitamin A, D, E, turmeric. There are so many different things which can be very helpful for acne, and they can be consumed in abundance. And again, the pattern of eating is very important when we eat. So, eating less in the night, we just talked about the circadian rhythm, and eating more in the day can again be very, very helpful in acne. Now, coming to another very sensitive topic, which is stress and acne, because acne has a lot of what I would say is a lot of psychosocial impact on people. Um, and so people feel judged and they feel self-conscious because of acne, and that's true for many of us. And then also we know that that causes stress to people, and then we also know that if a person is stressed, that can increase acne. This is a very common factor we observe for acne, where the person has high stress hormones, and very often people will complain that they are getting acne because of that. So stress and acne is a real thing, and I would say 30% of the patients coming to us, they do report it, that the moment they are stressed, they start getting newer acne. So of course, one thing is to acknowledge this possibility. The other is to have a clear treatment plan for managing stress, because that can have multiple different impacts. A good work on the stress axis and the emotions can actually help improve the food choices of the person also, their diet also, and their sleep pattern also, and of course, directly also impact the acne. So this is another thing we need to consider. And another impact of stress very often is scratching, because it then starts to affect the body image of the person, and then they don't like it. So they unconsciously or subconsciously start to scratch themselves. It is sometimes they are inherently itchy, their acne, but most often, very often, it's a subconscious response towards low self love. They are not loving themselves in the way they are, so they want to just tear them apart. And this is another very common phenomena. And what helps in this condition is to, build up self-love, build up that self-acceptance, and then of course have local measures like trimming nails, avoiding hands reaching the face. All those different things are very helpful. Then another, I would say, a very important factor and partly a controversial factor in acne is oiling. So in India, oiling is a built-in cultural practice that oil your scalp, oil your hair. They're very good for um, physical health also, and also for hair health, overall mental health also. Oiling is a very beautiful practice, but very often we see that in patients who are getting acne, uh, oiling is playing a very important role. Oil on the scalp tends to block the pores on the face as well. And then that blockage of pore turns into whiteheads, and then it can lead to a very severe acne condition. It is not true for everyone. There are a lot of people who will happily oil their hair and nothing will happen. But every month we see 2, 3 cases of very severe acne after oiling of the scalp. So that is one thing we need to be mindful of. And this is not a criticism to the practice of oiling one's hair, because oiling itself is a beautiful practice. But we also need to acknowledge that not everything is meant for everyone. So since it is a condition where oil plays a role in blocking the hair pores, so more oil added to the scalp can very often play a role in aggravating the acne. Plus, it can also aggravate the dandruff. So through that also it can cause acne. So it's one of the most important advices from us to the patient. Then pollution and acne. So pollution at this point of time is also in a way um, causing inflammation on the skin, and we are seeing that the incidence of many people, especially those prone to allergies or fungal infections, we are seeing that their acne tends to increase in times of pollution. But there also we draw people's attention not to focus. It's good to acknowledge that that may be playing a role. It's always good to come back to what is within your own hands, to wash your face. You don't have to use a face wash, but every time you go out, you just wash your splash some water and clean your skin from excess residues in order to take care of these aspects. And again, the healthier the body, the more resilient the skin is in order to withstand pollution also. Then another very common condition, in fact, I would say the the appearance of acne 20 years back and now has completely changed. 20 years back, in our textbooks, the acne we used to read was mostly driven by a bacteria called Propionibacterium acnes. It was a bacteria. But right now, 70 to 80% of our patients who are coming with acne, they actually have a fungal acne. So that means the microbiome on the skin is shifting from less bacterial, more bacterial, to a more fungal type now. And this has happened over the past 10, 15 years because of the changes in the environment. The changes are that we are more indoors, less sun exposure, more magnetic fields, electromagnetic fields, Wi-Fi, internet, um, the state of the human health, the food, a lot of antibiotic exposures. So antibiotics reduce the bacteria, increase the fungal elements within the system. So because of all these factors, the fungal overgrowth on the skin has increased leaps and bounds in people. So the dandruff has gone up. Dandruff is also a kind of a fungal overgrowth of a fungus called Malassezia, and then that causes a little tiny pimples all over the face of a person, which we refer to as sandpaper acne. People come to us and say कि हमारी skin smooth नहीं feel होती है, एक graininess feel होती है. So that is usually coming from dandruff, and there also oil plays a very important role. And then this is just food for thought. I won't say that this image is entirely precise and accurate, but there are some correlations that can be drawn by where the acne is located. Like, I would not entirely agree with this picture, but very often we see that when the acne is around this area, then it is more related to small intestine. And although, so this whole area actually, and so small intestine and liver, right? If it is more on the chin and the jawline, it is more hormonal nature. So it is also based on the location of acne that a doctor can draw certain conclusions about what really is, where is the pathology inside the body with regards to acne. Then another key thing is insulin resistance and acne. And now this is also brings us to the context of adult acne. Now, acne until 1990s was a condition limited to teenagers. And the doctors literally used to photograph, oh, this person is getting acne after the age of 19-20. It's a new phenomena, iski photo lo. And now we would see acne almost very commonly in 20s and 30s. A lot of people get acne, and we refer to it as adult acne. So it is no more limited to teenagers. And most of this is a lifestyle disorder acne, and the prime cause behind that is insulin resistance. Now, insulin resistance is something interesting which builds up into our body when the body is unable to detoxify what we are consuming, whether it is food related toxins, emotional toxins, and they accumulate as phlegm within our cells, and the cells start getting lazy. They do not respond to the insulin hormone well. And in process, the body starts making more insulin at a young age to maintain the sugar levels normal. And that excess insulin starts to thicken the skin. Like we see this picture, the darkening of the neck, darkening of the folds. And this insulin also tends to increase the size of the oil glands. We talked about the brain of the skin. And that leads to a lot of different acne. Arunima, do we have time? How much is it right now?
Yeah, we do have time.
Yeah,
It's been 30 minutes now, of course, 15, 20 minutes, of course.
I think I'll finish in 10 minutes. So this hormonal issue of high insulin levels is behind a lot of cases of acne, and to improve the acne, it is we need to work on this insulin resistance, and that is quite remarkable how those patients improve without any antibiotics, without any much medications, if we treat the core reason behind their acne. And the rates are that about 80 to 90% of acne, if somebody has acne after the age of 20, then there's a good 80 to 90% chance that that person also has insulin resistance. It may be severe, it may be mild, but it is playing a role. Then we just talked about, I think I've already touched upon this, how Ayurveda and traditional Chinese medicine view acne. And again, it can be varied relations. In acupuncture language, heart meridian, it's the heart which the emotions of the heart, which are expressed on the skin, or it is the liver inflammation leading to blood heat, leading to skin disorders. So there are various different views towards acne in Ayurveda and TCM, and it's good to take inspiration from that to make the understanding of acne or listening to the acne as a complete process. So we just summarize this. I'll go back and I'll touch upon each of these so that we have how we heard the pimple. We are listening to the pimple by understanding it at what's happening at a local level. We have an oil gland and a hair follicle which gets blocked because of the changes in the quantity and quality of oil secretion, which is primarily at play. And then this quality and quantity of oil secretion is affected by the gut, by hormones, by sleep, by food, by stress, by scratching, by oiling, by pollution, by dandruff, and also very different organs in the body and insulin resistance. And then we come to the second half of the presentation, which will be short and sweet, because once we have learned to listen to somebody, there's a very nice saying that amongst doctors, that if you listen long enough to a patient, then they will also reveal the treatment of their condition. So half of our job, or more than half of the job for all of us, is to listen. And then it actually naturally simplifies the process of treatment. So it makes, so this is the second half, which is keep it simple. And these are the top 5 things. And having treated now acne for about 13 years for patient, I can vouch for it that if a person is doing these 5 things, the there is a good 70-80% chance, unless they have a very severe acne, if they're doing these 5 things for even 3 weeks and for even good 3 months, there should be a remarkable change in their acne. There should be. And those 5 things are: one is in the diet, avoiding milk, reducing carbs, following a pyramid diet. If they have a little more motivation, if they add a vegetable juice, gajar, chakundar, carrot, beetroot juice, if they're sleeping on time, and if they're exercising in order to detoxify through the sweat all the toxins, using a simple skincare. So you don't have to have, so getting kids with teenagers using 10 different products on their face, having looked at it on Instagram, and then further irritating the acne in process. All you need is a simple skincare. I tell patients, I mean, we recently had I'm a dermatologist, so we recently had a dermatologist alumni meet where we were 100 dermatologists who were educated almost at the same time, got together, and many of them, are nowadays influencers on YouTube and Instagram, and they were like, "के Mankul, तुम्हारी skin इतनी glow कैसे कर रही है? What are you doing? What are you applying?" I said, "Apply nothing, zero. That is what I do. I apply absolutely nothing on my skin." And I was also, it's not to brag about myself, but it was so nice to see that, every photograph, my face was glowing more than theirs. This is not a comparison or a bragging. It's just to put this message across, and they are prescribing and marketing so many different products. Yet, something simple as not applying anything can do wonders if we are maintaining inner harmony. So, actually, on your skin, what reflects is inner harmony, expresses as outer harmony as well. So, we actually don't need too many products. Just, I don't even remember when I used the last face wash. This is how simple it can be. But having said that, we are all different and with different skin types. And for many people, cleansing their face properly itself makes a big difference. So cleansing and moisturizer sometimes is enough. And at best, they can have one little cream for their pimple at best. So if the other things are being done properly, then the role of topical treatment in acne is actually very little. And lastly, avoiding the oiling of the scalp and keeping it free from dandruff. So I've seen that if I close my eyes and any patient comes in and if they just understand and they just do these five things, unless the patient has severe acne, 70 to 80% of patients will improve just by doing these five things. And then another thing that we can do on our own is some simple supplements. Anything which helps in liver detoxification, helps with acne. N-acetylcysteine, vitamin E, milk thistle, Live 52, whatever be it, or various ways of naturopathic liver cleanses, whatever helps a person cleanse or detox their liver will help them in improving acne. Vitamins like vitamin D, vitamin A has a very important role in acne, so those things can be used. A lot of Ayurvedic herbs, the combinations like Khadira Rishtam, are very helpful in acne and can be used. And omega-3, N-acetylcysteine is a liver detoxifying agent. So many such things are very helpful. And in fact, a person doesn't have to see a doctor and can experiment with these ideas along with the dietary modification to see if it makes a difference. Then there are medications which obviously a doctor prescribes. And so even though those top five things can help many people, but many people can have huge acne breakouts and they do need to see a doctor. And we do prescribe medications and they are very helpful and effective. But this is where if we are doing those top five things, if we are doing these supplements, then the need for medication goes down drastically. For example, isotretinoin, हम लोग की भाषा में it's like a रामबाण for acne. What it does is it just shrinks the oil glands and it dries up the skin. So whatever the cause, whatever may it be, it improves the acne. But I see there is a dharmic use of isotretinoin and there is an adharmic use of isotretinoin. The adharmic use is when we give high doses, which dries up the skin and overtly dries up the skin and makes the oil glands numb to whatever signals from outside and inside are. And their pimples improve. And till the time they have the medicine for 6 months or 1 year, and when they stop, many a times, if the causes have not been taken care of, the pimples start coming back again. And the dose given was higher, so there are more side effects. This is again my perception that it is an adharmic use, but there's always pros and cons to every approach. And I don't think I should see it as black and white, but let's put it this way that it's not something it aligns with me as a doctor. Uh, the way at least I like to do it is to use it in a low dose. In patients who are having severe acne and looking to cope with it, we give it in a twice a week or in a small dose, which helps calm down the acne, yet allows us to listen to the acne. If the person is not eating right, still they will get new acne. So it helps the person cope with it, yet at the same time, the listening part can go on and the person can go through their phase of learning of what is it that acne is revealing to me. And that kind of ultimately leads us to a balanced treatment for acne. And then, of course, there are lots of different topical creams, but some things that people can use safely is niacinamide is as a part of moisturizers is helpful. Glycolic acid, a little bit twice a week can be very helpful. Azelaic acid and benzoyl peroxide are both very good, but just have a little bit of irritation potential. So one can use them as a short contact. 1 घंटा लगा के wash कर दे रात में. Or tretinoin, 1 घंटा लगा के wash कर दे. Don't overuse it. Tretinoin benzoyl peroxide, azelaic acid can be too irritating for the skin. These things are now available easily over the counter as so many different products. So one just needs to be careful with them. We get a lot of patients with adverse effects from over application. So very gradually build them up into your routine. And lastly, because yes, is the context is yoga, education, and spirituality. So yoga is also has a huge capacity and role in acne. First, the process of listening itself is a process of yoga because one may treat it as डॉक्टर साहब किसी तरह इसको ठीक कर दो to being grateful that this is some impending learning for us. So being receptive and peaceful in order to listen to it, that what is it here to reveal to us. So the essence, that's one part of the yoga and acne. And then whether it is the physical yoga poses or the pranayama, which can really help in detoxifying the body and building up balance. Yoga is an excellent process for insulin resistance, hormonal issues, and for the gut and the liver. So it can build up body harmony also, and it can also reduce the stress related acne, whether it's meditation or physical processes. So we see profound results in people who adopt yoga as a lifestyle in improving acne. And then also, yoga becomes a way to also accept oneself the way we are. Because since it is something which can lead to self consciousness, low self love, low self esteem, yoga also teaches us unconditional acceptance, unconditional love for oneself in whatever way and form we are. So, patients who are very conscious, we tell them to stand in front of a mirror and repeat to themselves, I love, accept, and love myself in whatever way and form I have been created. So, it helps them with their body image and they're able to take an attitude of gratitude and not give it over importance in their life and treat it as just one little part of their life. And that brings us lastly to acne scars. So scars, as they say, that there are some people who get pimples and they just fade away without any semblance of any marks. But sometimes there can be people who get acne and they leave behind deep depressions in their skin. So, which person will get deep depressions and which people will get not so deep depressions or no marks depends on a lot on the skin and the physical health and on the emotional health. People who tend to scratch a lot, so they don't have self acceptance, they get much deeper scars. People who just don't fiddle with it, just let them be, get very little scars. So, the self acceptance has a very important role to play in the whole process of treatment of acne. And that brings us to the conclusion of listen to your pimple and keep it simple. And I thank you all for patiently listening to this and quite happy to answer any questions if you have.
Thank you so much, Dr. Mankul, for such a comprehensive and insightful session. And really appreciate your expertise and the valuable information you shared today. As you said, we can check with the participants if they have any questions or they want to share something. Participants, please go ahead. You can use the chat box or simply unmute yourself and speak up.
This is me too. Thank you, Mankul, for a very topic which I did not know much about. But of course, in my peer group and all, I used to see all these problems cropping up. So I have got a deeper understanding of it. Only one thing I just wanted to know that somewhere they say that the healing sounds, the musical, you can say notes and all, they have a lot of effect on the skin, particularly the vibrations and all. So, does it also affect the healing from the acne? And what is actually known about it? And also fasting. Like my mother used to say this, that, and she had heard it from her mother, that when there is a turbulence in the skin and all, so you for some time you stop eating, like intermittent fasting kind of a thing helps. So can you throw some light on these two?
Beautiful insights, Mithudi, what you just shared. I'll start with the fasting bit because that's a more simpler answer. So that's very, very true. And in fact, it could be in the diet section of the top five things. Fasting is actually a very effective remedy to reduce the acne. And to be honest, this is the first thing I do if I happen to get an acne. Is, if I know that, okay, it's time to fast for a day or two. And it's the way we experience it is that the pimple loses its power. The inflammation, the size, and the nodularity goes down much, much faster if the person is fasting or eating very little, move to a fruit diet for a few days, or a vegetable juice based diet. So we see that the pimple improves much faster. So absolutely, whether it is dealing with an acute episode or in general, if one is going through a lot of acne, timely fasting can be very, very helpful. When it comes to healing sounds, so to be honest, I have never really explored using healing sounds per se as a means to treat acne. But obviously, the from an energetic aspect, if it builds up harmony in the system, it will help on the skin. From an energetic aspect, a lot of skin issues are stemming from root chakra, or a fight within the self, or fight with the environment. The person is more in the fight and flight. And sound therapy itself, anything which helps build up, reduce that friction between oneself and the environment, um, can build up more harmony, can also, I believe, improve the skin. But honestly speaking, I have never explored it. But I would like to share that I did have a low level laser light device which had ultrasonic waves. And low level laser light refers to a light which mimics those sun rays or those frequencies of light which are present in the sunrise, absolute sunrise. So they're in the infrared spectrum, just the early रेड लाइट्स ऑफ द सन जो सूर्योदय और सूर्यास्त की रोशनी होती है, तो उन फ्रीक्वेंसीज की एक लाइट होती है विच एक्चुअली चार्जेस अप द सेल्स. So that light is very helpful in treating acne. So that can really calm down the acne much faster, and it heals much faster. So that is something that I have seen quite a bit. But usually we don't end up doing it too much because it involves people having to come to the clinic, whereas we try to offer solutions which are available at home itself. But yes, as the world is shifting, the treatment is moving towards more energy based healing rather than medicinal healing. So definitely you've shared two key insights on acne. Thank you.
Thank you, Mankul.
Thank you, sir. Participants, anyone else has a question, please go ahead. Dr. Bijlani, sir, before closing, I request you to share your thoughts, please.
Yeah. Arunima, as you said, this has been an extremely exhaustive and comprehensive presentation. hardly anything that has been left untouched. Everything that could be possibly related to acne has been discussed and discussed very adequately, including the changing trends. What has happened in the last 20 years as compared to what it used to be earlier, and why now adults are also getting it sometimes. Uh, So there's hardly anything that has been left. And of course, the platform is yoga education and spirituality. So, as was expected, he has left. He has sort of left that also not untouched, and talked about the dharmic and the adharmic use of drugs, and the how yoga and the spiritual acceptance of what it is can also help in the treatment. But just for sake of a general question, which I very often sort of think about, these days it's very common to talk about detoxification or detox, as you also used at a few points. Uh, is it to be taken in just a sort of a figurative way, or do we, in any of these cases, really know which is the toxin that we are trying to get rid of?
But actually, the toxins we are referring to are, basically detox is a constant process in the liver. There are a lot of, I would say, endocrine disrupting chemicals, a lot of chemicals present in processed food. There are endless number of things which the body is constantly detoxifying through the phase 1, phase 2, and phase 3 of the detox pathways of liver. And the fatty liver can be looked upon as those things which the liver was unable to detox, and then those toxins are being stored in the liver as fatty liver. So there are endless number of such things, and there is not one specific thing that we are trying to detox. But usually, for us to quantify those levels of toxins, fatty liver or insulin resistance is one way. Because if the body or the cells are relatively free from such things, then the level of insulin resistance and fatty liver is very little. So it becomes, in a way, insulin resistance is most often seated in the liver, muscles, and the adipose tissue, the fat. So if these three things are fully functional, then these things don't happen. Taking a cue from the alternative medicine, sorry, I won't like to use the word alternative medicine, but from Ayurveda and Chinese medicine. From Ayurveda, there is the word ama, which is basically food which is undigested in the gut, then is develops into ama. So it doesn't even have to be processed chemicals, but just food which sits there and rots and is not fully digested. If a person eats late in the night and then goes off to sleep and eats a heavy meal, then it is not fully assimilated, and then it rots and it creates ama. From a scientific perspective, bacteria, fungus, they will grow on it and produce toxic molecules, so to say lipopolysaccharides and other things. So they cause endotoxemia. So those things are what how Chinese medicine, sorry, Ayurveda refers to it. In Chinese medicine, they refer to as phlegm, is the word English translation of the Chinese word. They refer to as phlegm getting deposited. So that is actually what we are referring to toxins. So toxins in allopathy, ama in Ayurveda, and phlegm in Chinese medicine.
Thank you so much. I wish I had a doctor like you to turn to when I was young and had pimples.
You're still young. If we nowadays there is a trend of calculating the biological age or DNA age of people. People are doing this. So I'm sure behind we check your DNA age, it will still be quite young.
Thank you, sir. Before closing, I would like to inform that the recording of today's session and all Yes Talks are published on our YouTube channel, Yes Spirituality. Please do visit the channel and explore extensive content on yoga, education, spirituality, and related subjects like psychology and wellness. Dr. Mankul, thanks once again for sparing your valuable time for all of us. And participants, thank you for being with us today. We'll close today's session with a moment of peaceful silence. Namaste.